I'm delighted to be here, and I'm especially delighted to be on this side of the podium instead of your side of the podium, because 3 years ago on this very day, I was looking at my first knee replacement on October 10th and my second in April. I wish I had known then what I know now, because I wouldn't have needed to be nearly so frightened as I was. I'm going to tell you about 4 aspects of my experience, and these slides are in your book, so if you want to make notes on a few of them, you can. First, deciding when to have surgery, then my hospital stays, going home in rehab, and life with my new knees. The first dilemma is, should I have surgery soon or wait as long as I can? I had seen 2 other orthopedists before I came to this practice, and they had each told me exactly the same thing. There will come a day when you say, do it, I don't care what, and that's when you should have your surgery. But one of them proved to be too far away for me to drive, and the other sent me a letter that he was moving out of the state of Pennsylvania. So a lady who saw me limping into Trinity Cathedral downtown came to me and said, "You've got to see Dr. DeGioia." In the year that she turned 80, he had replaced both of her knees, and a few weeks later she was hopping off and on buses, going wherever she wanted around Pittsburgh from her home in Oakland. So I made my appointment, and these are pre-surgery x-rays. They are not actually my x-rays because the practice was not storing them in a digital form at that time, but they give you an idea of what arthritic knees look like if you haven't seen them on your own. Dr. DeGioia came in right on time. He was wearing a blue and white plaid shirt and charcoal slacks, about the way he is today, not the traditional lab coat of the doctors I had seen before. He looked directly into my eyes. He reached out his hand and said, "Hi, I'm Tony." And right away, I relaxed. He looked at the x-rays and he said, "You are a candidate for replacement. You decide when. It takes about 5 months to get on my surgery schedule, but first we can try injections." And at this point, I want to interject something, and that is that not everybody who comes to this practice does get knee surgery. One of my friends is a surgeon. He came apprehensive, as you might expect, expecting a surgeon to tell him he needed surgery. But Dr. DeGioia said, "The pain in your legs is not something that can be taken care of by knee replacement," so Dr. DeGioia referred him to somebody else. Another friend, who's a professional woman, came, and he said, "Not yet," or "Not now." He said, "Let's try injections, and why don't you do some exercises?" She joined Curves. She's lost 30 pounds. She looks wonderful. She got injections, and she's getting along for now. Back to me and the injections. My reaction was, no injections for me. I've already had them, and I know that they don't work. But he explained something about the substance that he uses, which I can't go into. But I said, okay, I will try again. And I had 3 wonderful months when I felt as if I had been to Lourdes. Then the effect wore off. And we tried them a few times, and each one did as he predicted. It lasted a little less than the time before. And finally he said, "You know, I think that we've gone as far as we can go with the injections." Gradually, I was doing less and less at home. I was going out less. I had stopped traveling altogether. But thankfully, I had already wisely gotten on his surgery schedule several months before, so I didn't have to wait weeks. And believe me, when it came to September, I was really glad that I was only 3 or 4 weeks away from my surgery and that I didn't have to face another 5 months like that. I still may have waited longer than I should. I put this in the category of things that you don't know that you don't know. I experienced what I called collateral damage. Dr. DeGioia calls it indirect effects. But I had effects on my back, my foot, and my wrists. That old song, "The hip bone's connected to the thigh bone," was true in my case. I was walking so bent over, I was like this. My 94-year-old friend imitated me. I said I looked like the last quadruped, the last creature who walked on all fours when everybody else stood upright. But I still have trouble standing straight up, and every day I go to the wall and I stand up straight against it just to check myself at how much I'm still bending over. Another thing was my foot. The bones in my right foot collapsed from the extreme pressure that I was putting on that leg to try to reduce the pressure in my left leg, which was the worst one and was going to have surgery first. However, 3 weeks before I was scheduled for surgery, we had to change the surgery plans because it was obvious that my right foot was never going to hold me up. The other thing was my wrists. I was using my arms like auxiliary legs to hold my body up when I was going downstairs, to pull myself when I was coming upstairs, to lift myself into a chair, pull myself up. I still have some pain in my wrists from time to time from that. So I'm going to offer you these two questions to ask yourself. How much is my world shrinking? What am I doing less of or giving up because of pain or reduced mobility? And, very importantly, am I walking unnaturally to compensate for pain or limited mobility? And is that causing problems in other parts of my body? And here's Scott. I met Scott at this function in Monroeville in June. Scott was scheduled to have a hip replacement on July 10th, but he came to the event pretty much sure that he was going to cancel it. He heard the orthopedic staff speak, and he met a lot of other patients who had already had hip replacements, but he was still apprehensive. And we ran into each other in a restaurant afterwards, and I asked him those two questions. Oops. I won't go back. And he demonstrated for me how he was walking. And in the process of demonstrating that, he realized how much he was throwing his good hip out to compensate for the bad one. So he went ahead with the surgery as scheduled, and we keep in touch, and he wants you to know that 8 weeks after his hip replacement, he was able to go with his mountain bike group on a 2.5-hour trip. Now I'm going to tell you about my hospital stay. And here are my new knees, and I guess this is my first chance to be a poster girl. In both cases, I had my first surgery, I had my surgeries at 8 o'clock on Monday morning, and I went home on Thursday afternoon. With my second surgery, I was up walking around in my room by 6 o'clock in the evening. I was going to the bathroom. I was walking out into the hall to talk with other patients who had had knee and hip replacements that same day. Dr. DeGioia talked about the wellness center here. Well, see it, because it doesn't look like anything else you've ever been to in a hospital. But you will miss the ambiance. It's like a resort with canes and walkers. Patients, but there aren't any patients there today, are there? Okay.
The gym's open.
But it's look at the gym. I'm going to talk about that in a minute. But everybody wears street clothes. There's a lot of camaraderie that develops in the patients very quickly because it's like a war experience. You have been in the foxhole together. But the staff is remarkable. Everyone from the surgical staff, the nurses, down to the people who bring you your food trays and who clean your room. Everybody cares about you in this process, and you begin to care about them. I met several staff members who had given up seniority at other facilities to come here to work in this practice, and some who had given up jobs that were close to where they lived so that they could come to be in this service. From talking to people around the country, I think this is not only the state-of-the-art service, but it creates the state-of-the-art.